Thank you. Yeah.
Thank you, Cathaoirleach, and first of all, thank you to the Labour Party for tabling this motion in the first instance. Minister, the backdrop to any discussion that we have on healthcare and healthcare delivery is obviously tainted now by the fact that in the budget just gone, there was very little, if any, new funding for new measures right across the healthcare system. And that was a very deliberate decision that was taken by the government, not only not to provide additional funding for new measures, but not even provide enough money for the health service to stand still. And we know that will have consequences. We can see it with a recruitment embargo in some areas of the front line already. And over the summer months, Minister, 2 million hours of home care were sacrificed as well because of changes to the home support tender. And there hasn't been any significant increase in home help hours, certainly not in last year's budget and certainly not in this year's budget. So we know there are 5,000 people who are waiting for home care support, many of them waiting for intensive home care packages, and they can't get them. And I want to pick up on a point that Deputy Sherlock made, because it was one I want to make very forcibly myself. How did we arrive at a situation where the vast majority of care for older people outside of hospitals is delivered by the private sector? And that's not a reflection on the private sector. And obviously people who operate in that space and those who work in it and who are trying to provide the best services for older people do their best. I'm not calling into question the quality of the care, but there is a responsibility on the state to provide adequate infrastructure, capacity and supports for older people. We had a motion not so long ago on nursing homes, and again we know the vast majority of nursing home beds are private and not public, and we simply haven't built anywhere near the amount of public beds that we need. The same in home care. The vast majority of home support is not delivered by HSE personnel, but delivered by non-HSE, community, voluntary, but also private for-profit organisations as well. And all of the problems are the same, whether it's in nursing homes or whether it's in home care support. One of the big challenges is recruitment and retention of staff, and that we have this merry-go-round where we talk about this all of the time. We go around in circles, but we're actually not solving the problem at all. So we really do need to rebalance the scales in relation to public capacity versus private capacity, because in my view, the best way for the state to control and to ensure that older people have the best care that they need is to actually have more public capacity. So I certainly support my colleagues in the Labour Party who spoke in very similar language. And the other issue then, Minister, in relation to home support is the number of hours which are available and whether or not people are actually getting what they need. Because there's a big difference between what the established need is and what a person gets. And we know that there's a lot of people on waiting lists, but even people who are getting home care support, because of shortages in staff, because organisations in the HSE are trying to cut their cloth according to measure, we know that many people simply don't get the home support that they need. And for me, that flies in the face of Sláinte Care and flies in the face of what we need to do to better manage our healthcare services and to ensure that we're actually getting bang for buck for the money that we spend. It was again talked about, and it's included in the Labour Party motion, that we don't have a statutory home care scheme. That was clearly in the programme for government. I have no idea when that will be brought in. I want it to be brought in, but even if it's brought in, even if we bring in a statutory home care scheme, the first question we have to ask is, have we the capacity to deliver it? What will actually change for people? And I don't believe that we have the capacity to deliver it in the way that certainly originally it was designed to do. And maybe that's the reason why it hasn't happened as quickly as now. So I have a real fear about that we would just, you know, in very cosmetic ways, bring in the statutory home care scheme and say that's a box ticked, but in reality it doesn't change anything for patients. If we bring in, or for older people, if we bring in a statutory home scheme and do it the way it was intended to be done, that means we have to completely rethink that whole space, including the type of patients that will be in nursing homes, for example, who will have higher dependency and higher needs, more people being cared for in the home. What does that mean in terms of staff and capacity and so on? And I think that we simply haven't done any of that groundwork, and I think that's the real challenge that we have. So I support this motion. We have made very similar proposals ourselves in our alternative budget just gone. And the final point I'll make to you is this, Minister. I welcome the fact that this government moved on the expert review into pay and remuneration for home care support with the living wage, but the travel expenses wasn't done. And I took a very simple view. Let's just do it all as quickly as possible, not drag it on. There was recommendations made on travel and subsistence as well as the living wage. That should have been done in the budget just gone, and it wasn't because of the decision that the government made to underfund the health service.